It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center, and we are pleased to have Dr. Mila McManus with us. She's lovely, delightful, intelligent, and she's very much an expert on bioidentical hormones. So today we are going to be discussing thyroid, aren't we, Dr. Hotze?
Thank you so very much, Stacey. And thank you for joining us here on Dr. Hotze's Wellness Revolution, where we believe that you need a doctor and a staff of professionals who have the wherewithal and the know-how to coach you on the path of health and wellness naturally. So as you mature, you got energy, you've got vitality, and you've got enthusiasm for life. And that's what our goal is. And those doctors that practice natural approaches to health, like Dr. Mila McManus, who is the founder and owner of the Woodlands Institute for Health and Wellness, located, of course, in the Woodlands, Texas. Dr. McManus was trained under the American Academy of Bioidentical Hormone Therapy, which I established back in 2003, 2004. She adopted the natural approaches to health systems and procedure and the business model that we taught, and she took it and ran with it. She'd been practiced conventional medicine for 1 year, having been a board-certified family practitioner. She realized that wasn't going anywhere, and she needed to try something else. And so she decided to adopt natural approaches to health with the treatment of natural bioidentical hormones, natural thyroid, good healthy eating programs, vitamin and mineral supplementation, and several other modalities. Today I wanted to visit with her about hypothyroidism. The thyroid gland, of course, is located in your neck, produces thyroid hormones. The thyroid hormones, T4 and T3, are the hormones that are produced. T4 is the inactive thyroid hormone. 94% of the thyroid hormone you produce is inactive. It has to be converted to the active hormone T3 within your cells to enable your cells to produce and use energy, to increase your metabolism. It's like a spark plug. It makes the mitochondria, the power plants of your cells, function. And without thyroid hormone, you're going to operate at a low metabolic rate and not feel good and have a host of health problems. So, Dr. McManus, tell us about your experience in dealing with individuals that have the signs and symptoms of hypothyroidism, but their blood test may be normal. How do you approach hypothyroid patients, and what kind of symptoms do you see in patients that have low thyroid condition intracellularly?
Yeah, wow, that's I see it all day, every day, and I had the same problem back when I met you in 2004, and I enjoy explaining this to people because they've just been untreated for so long with their other doctors. And what I explain to people is that just because your thyroid is floating around in your blood so that it shows up normal on a blood test doesn't mean it's getting into the tissues where it actually has its action. And so if you've got symptoms A through Z that spell low thyroid, you have low thyroid function. We have to figure out why that is. And it's usually multiple reasons. And, I like to explain to people, like you mentioned, spark plug, that our thyroid is our engine. So if our engine slows down, everything slows down. So our energy is lower, our brain function's lower, our mood is lower, our pain threshold's lower, our temperature's lower, our metabolism is slower, our bowel function is slower, etc. And so my usual approach is to assess other hormones, because generally if somebody has low thyroid, all their hormones are out of whack, especially their adrenal glands. And I explain the connection of how, your adrenals need to be working properly for your thyroid to get into those cells to work properly. And if your estrogen and progesterone are out of balance, as we discussed on the last podcast, that indirectly also affects the way your thyroid functions inside the cells. So we cover a lot of ground. Of course, there's nutritional issues, there's gut health issues. I think about 25% is the number of your active T3 is converted in the gut. And so if your gut's not healthy, it's not making your thyroid do what it's supposed to.
Now, this is a very important point that you make. And it's the whole concept of gut health, intestinal health. And there's an old adage that if you want to keep somebody healthy, they have to have a healthy intestinal tract. And because of the overuse of antibiotics in our country, what it does is it destroys some of the natural bacterial flora that we have in our intestines, and we get yeast overgrowth and get a host of problems. And that's a whole other program on that. But the important thing that Dr. McManus points out, it's not how much thyroid you have in your blood, it's how much thyroid, active thyroid, which is T3. T3 is the active thyroid hormone. Think of the thyroid molecule is a circle, and on that circle you've got four prongs coming out of it. That's T4. Those are 4 iodine atoms. That is the inactive pro hormone. That T4 is made in the human body. 94% of the thyroid gland makes T4. The thyroid gland makes T4. 94% of the thyroid hormone is T4. It has to enter the cell, and in the cell, that thyroid atom is cleaved off by the deiodinase enzyme. Deiodinase, that means to remove an iodine. And you get T3. That's the active thyroid hormone. In our blood, there's only 6% of T3. But the T4 has to go into the cell and be converted. Now, here's the problem with looking at blood tests, which most conventional doctors do. They look at the thyroid stimulating hormone. And what they do, what a lab study does, or the lab does, is over the last 1,000 tests of thyroid, they measure the mean or the average. And then they add 2 standard deviations on each side. That's a statistical term. 2 standard deviations from the mean or from the average incorporates 95% of the population. They call that normal. 95% of the people will always come out in the normal range on your thyroid stimulating hormone, which doctors use to determine whether you have low thyroid. In a study that I did years back, I did 40 patients, and I sent their blood to 2 different labs simultaneously, and I got 50% different in results of thyroid stimulating hormone. So I had to decide, who am I going to believe? Lab A, Lab B, or the patient? Well, I'm going to believe the patient. And I think you do the same thing, Dr. McManus. If a patient has the signs and symptoms of hypothyroidism, even if their blood test falls within a wide range of normal, what do you do?
I'm going to treat the patient. So if thyroid hormone supplementation is what they need, that's what we'll do it. If we've, addressed other factors like the gut health and balancing other hormones, and they continue to have thyroid symptoms, then we got to try them on thyroid.
Well, and I believe the same thing. If a person has the signs and symptoms of hypothyroidism, no matter what the blood test shows me, I believe they deserve a therapeutic trial of thyroid to see if they improve. And we found we've had thousands of patients that were on synthetic thyroid who looked hypothyroid, who felt terrible, who the doctors had said, now your blood tests are normal. It can't be thyroid. Well, sure it is, because when we take them off the synthetic thyroid, Synthroid, Levothyroid, Levoxyl, and put them on natural desiccated thyroid, either Armour, Nature Thyroid, Hotze Thyroid, or T3, T4 combination, they perk right up. They do well.
It's because most doctors aren't checking the T3 and the reverse T3. Right. All they're checking is TSH and T4. They're missing half the picture.
That's exactly right. And plus, they're not listening to the patient. And the most important way a doctor can determine if a person is hypothyroid is to have a strong suspicion of it and take a good clinical history of the symptoms. And here are the common features that we see in low thyroid. Low energy. They'll talk about on a scale of 1 to 10, what's your energy level? 10 being brimming with energy, 0, no energy. They'll go like, 5, 4, 3. They think it's that. Once you get them up on thyroid, they'll go say, I was a 1. I didn't realize how bad I was. Well, thyroid governs your metabolism. If you're getting low, and as you age, your thyroid levels inevitably are going to decline, or as all your hormones do. They may fall within the range, but if they've fallen 50% within the range and thyroid enables your cells to produce and use energy, you're going to be making less energy. So it's low energy, difficulty in losing weight, in most patients with low thyroid, although I've seen patients skinny as a bone, and you give them thyroid, and all of a sudden they had a failure to thrive. You give them thyroid, and they bulk up, and they start looking good again. So, but it's primarily low weight. It's difficulty with weight, low body temperature. Your body temperature during the day should be 98.6. We see routinely women coming in the 97s, even in the 96s, which is a sign of low energy production because the excess energy the body produces is given off as heat. Inability to focus and think clearly, poor sleep habits, mood swings, depression, irregular menstrual cycles, joint and muscle aches and pains, sluggish bowels, recurrent and chronic infections. In women, hair loss, puffiness, paleness, loss of the lateral third of the eyebrows, enlarged tongue, ridging of the fingernails. All these are common features, some or all, of low thyroid. So a physician that is aware of the clinical symptoms of low thyroid can make that diagnosis. I oftentimes walk with my wife. We're walking somewhere, and I go like, "Here comes another low thyroid patient, honey." She goes, "Quit saying that." I said, "She is." I've even seen some patients so bad that I've gone up and give them. I remember one patient I saw was classical hypothyroid with eczema all over the legs, and I went up and I handed her a card. I said, "I don't know if anybody's ever told you, I'm a doctor, but you have hypothyroidism." I went to my here's her voice. She's got a husky voice too. I went to my doctor, and he said my blood tests were normal. I said, "Well, honey, your blood tests be normal, but you're not. You've got low thyroid." And so I see so many people, and one of the reasons for this is fluoride in the water, fluoride in the toothpaste. Go look at your toothpaste, folks, and look at the warning. If you consume and swallow the toothpaste in the toothbrush, it says on the side of the package, call your doctor or go to poison control. That's what fluoride is. It's a toxin. It's in the toothpaste. It's in the water. Get reverse osmosis because fluoride blocks your deiodinase enzyme and prevents you from converting T4 to active T3. So what kind of results do you get when you give the thyroid, when you switch people from the synthetic thyroid to the natural occurring thyroid to desiccated thyroid? What do you find?
I get a lot of hugs.
I bet you
I find that people get their lives back and they perk back up and they feel better and they lose weight and they're sleeping better and their mood's better and life is good.
Well, thyroid is a key hormone. I personally built our center, the Hotze Health and Wellness. It was an allergy practice, and we still do allergy, but using desiccated natural thyroid and using natural progesterone were huge game changers for us and for our guests. So I'm glad that you're providing the same excellent care to your guests in the Woodlands. And I know when you said they get their lives back, have you ever had a patient tell you, "Thank you for giving me my life back"?
I have.
All the time.
Mm-hmm.
Well, Dr. McManus, God bless you and congratulations on the wonderful work that you're doing out in the Woodlands and the example you're setting. I wish every doctor in America would follow your example. I guarantee you the people in America would be a lot healthier. Drug companies wouldn't be making much money. It might cause the stock market to crash, but people would be healthy and happy.
They absolutely wouldn't. And how can people find you, Dr. McManus?
Well, our website is twihw.com. That stands for the Woodlands Institute for Health and Wellness. So again, it's twihw.com.
Well, that's great. And we can get your book out there too, which is called A Highway to Health.
Yes.
Highway to Health. Thank you, Dr. McManus, for joining us today.
Yes, thank you, Dr. McManus.
Thank you. It was my pleasure.
And so if you want more information, you know where to go for Dr. McManus. She gave out her website, but also the quality of the prescriptions that you're receiving, the hormones, is very important as well. So definitely, ask your current doctor or ask Dr. Hotze or Dr. McManus. They would all recommend physicianspreferencerx.com. You can go to physicianspreferencerx.com. The customer service and the quality are excellent and highly recommended. Thank you for joining us today here at Dr. Hotze's Wellness Revolution.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.